Alexis, when you promised us a tropical getaway, you did not tell us it was a deserted island a million miles from nowhere.
No wonder the flights were so cheap.
At least you could have let us change our clothes after the last shift.
I didn't know, and I wanted you guys to get the celebrity treatment.
Hey, it's not a total bust. I found this volleyball, and I don't think this place is deserted. There's a guy over there.
Fantastic. Who has a lighter?
We're cardiologists.
Don't you have a show to do?
Doc, I'm going to have to call the producers. We're not going to make it. I'm going to have them cue up an encore presentation.
Well, if it gets too hot while we're waiting, I can always wear this.
From the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday, I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning. I'm Alexis Del Cid. Welcome back to All Things Heart. Here's what we're talking about today.
Looking back now, it helped me feel strong. It helped me feel like I had control over something.
She took a devastating diagnosis and she created something powerful. And doctors say her passion helped save her life. It's something all of us can do as well. Plus, we share the guidelines that the studies back up that these things really do better your heart health. And you can start implementing all these things easily today. We love that. And we love your questions. They're the heartbeat of every show, so be sure to send them in to us on YouTube, Facebook, and at the All Things Heart email. You'll find all those links on how to connect with us right there on your screen. And now to a patient who will inspire all of us. Janine Kiesling shows us how Angela Candiano found her strength to help her win the fight of her life.
He goes, you have just blossomed. It reminds me of a monarch butterfly.
1 month after she finished her cancer treatment in April of 2014, a personalized bra was made for 37-year-old Angela Candiano so she could strut her stuff in this monarch butterfly bra at Art Bra KC, a fundraiser for breast cancer.
I just had a gut feeling like something was wrong.
Angela was coming off a grueling year-long battle with breast cancer.
The doctor came in and she said, I need you to sit down. You sit down a minute. And she said, I'm looking at your films from when you were here 9 months ago. And she said, it looks like I am looking at a completely different person.
In 9 months since Angela's last mammogram and sonogram, 5 cancerous tumors had developed. Her doctor told her to find an oncologist immediately.
Everybody said the same name, Dr. Fabian at KU. She got me in right away. And they were starting chemotherapy that following Thursday. So it wasn't even a week.
Angela had stage 3 breast cancer, and it was aggressive. She had weekly chemotherapy treatments for a year, followed by radiation and a double mastectomy. Angela stayed positive throughout the process, but knew the odds were against her. Instead of taking it easy, Angela hit the gym.
And I think looking back now, it helped me feel strong. It helped me feel like I had control over something.
Angela beat her cancer and wants to help others facing breast cancer diagnoses. She's getting certified to be a personal trainer and has plans to start a not-for-profit to help others battling breast cancer through fitness.
My ultimate goal is to be able to provide them with a path for them to feel more confident about themselves, for them to feel healthy, for them to get strong.
Exactly 1 year after Angela woke up from her reconstruction surgery, she entered her first fitness competition. And guess what?
It went great. I won. Well, that's pretty amazing. You look fantastic.
Oh, thank you so much.
So we're joined here in the studio by Angela Candiano, along with her breast cancer oncologist, Dr. Carol Fabian. And we also have Angela's gynecologic oncologist, Dr. Andrea Jewell. Thank you for being here. Angela, you won the competition, and just to be clear, you started working out during your breast cancer battle.
I sure did.
When most people are feeling the most in the weeds.
Yes.
You hit the gym.
I did. Yeah, I think I just needed to feel strong. I needed to do everything I could do possible.
And how are you feeling today?
Wonderful. Wonderful.
When we talked on the phone, you said you were feeling better now than you even were before you were diagnosed with cancer.
Yes.
Better
absolutely.
than you have in your whole life.
Better than I have my entire life.
And do you attribute that directly to you taking up the working out?
Yes, absolutely. Yes.
That is incredible. How much did you work out before your diagnosis?
Not very much. I would work out maybe 2 days a week, and just do a little bit here, a little bit there, and then I was diagnosed with the breast cancer. And after Dr. Fabian, diagnosed me with that, I needed to feel strong, and I needed to feel confident, and like I can get through this. So,
and honestly, you have every reason to feel confident.
Yes.
You won the competition. We're going to bring in your amazing doctors in a minute, Dr. Fabian, Dr. Jewel. We also have a message from Dr. Porter. He's your cardio-oncologist. He's out of the country now.
Okay.
But here's what he had to say on the power of using exercise as medicine.
Exercise is medicine, and the evidence on what it does is increasingly powerful, that there are basic elements of human function beyond just your muscles that are changed by exercise.
I see everyone nodding their heads, yes. Dr. Fabian, I want to start with you. Do you discuss exercise with your cancer patients?
I do.
And what do you tell them?
Exercise is good, not only to reduce overall risk of death, whether it's from breast cancer, heart disease, diabetes, all kinds of things. Just like Angela did, exercise, some type of exercise is good if you can during your cancer treatment because it reduces fatigue. That is probably the big thing. And of course, exercise is wonderful after your cancer treatment. One of the big problems that we've had is it's so difficult to do these very large studies on exercise. Most of them are short-term, 6, 12, 24 months, but there's just usually not the money to do really long-term randomized clinical trials. So most of what we know about exercise comes from what we call observational studies, and those really indicate that exercise is very good. For breast cancer, particularly for breast cancer prevention, just like Dr. Porter said, we're learning that it has some very specific ways that it can benefit. It can help increase the expression of genes that fight the development of cancer, and it can reduce the inflammatory components, as well as in premenopausal women, hormonal levels that can increase the risk of breast cancer.
So if like a pharmaceutical company could put that in a pill and prescribe it and make money, there would probably be more studies from it. And it must be frustrating as doctors to see such a powerful thing that we all can start doing. And Dr. Jewel, do you attribute Angela's recovery to also the exercise that she's doing?
Well, yeah, absolutely. One of the things I talk to patients before they start chemotherapy or have surgeries, you're going to start here and this is going to take you down. So whatever you can do to help build up that reserve, that's going to put you in a better position to be able to fight this and tolerate treatment and get through everything. I also think a lot of patients feel overwhelmed that oh, well, I need to do this hour-and-a-half class every day. And I really try and focus a lot on even taking a long walk. Like we know that just daily 30 minutes of intentional activity, it doesn't have to be, a really strenuous exercise class. And so I really try and focus on just try and be active, try and get up, try and move around. We know that even has benefit.
I want to ask Dr. Fabian about Angela's tumors. They developed so quickly over 9 months, at least it seemed 5 tumors over 9 months. Does anybody know why that happens or how that happens so quickly?
I think in her case we do now.
Yeah. And what did you learn?
She has had a special type of cancer called HER2 positive. HER2 is a growth factor. which unfortunately, not only can it be in the breast tissue, but it can also be on your heart.
Yes. Oh, wow.
Yes. So she had a special type of breast cancer called HER2 positive, estrogen receptor positive. These cancers develop very, very quickly, often in young women, and they often develop in multiple sites in the breast tissue, and they often occur on both sides. We didn't know why she got that at the time, and it was only as part of a secondary round of genetic testing, because her first round, when she was diagnosed, she was BRCA1 and 2 negative. But when it became available, a second type of genetic testing called panel testing showed she had something called an ATM mutation. This type of mutation that she inherited from one of her parents, I suspect her dad, does cause frequently this kind of cancer. HER2 positive, estrogen receptor positive, and it often occurs bilaterally, and it often occurs in very young women just like her.
Wow. And Angela, you're nodding your head yes. So does this kind of cancer runs in your family? Did your dad have cancer?
No, he did not. He did not. But he was adopted, so we don't really know a whole lot of his background. But my mom, no one in her family, had cancer either.
I want to bring in Dr. Jewell. Dr. Jewell, you're a gynecologic oncologist, and you became Angela's doctor because the medication to fight her breast cancer caused precancerous cells to develop on her uterus. Yes. So then what did you have to do for Angela?
Well, initially, we did a lot of surveillance and biopsies, which I have a decent number of tamoxifen patients that we follow along for ultrasound findings and bleeding. And the overwhelming majority, I do want to say, have benign biopsies. The overwhelming majority of women on tamoxifen do not develop precancerous cells or cancerous cells. But we know that you're at a slightly higher risk of developing polyps or precancerous cells, and so we have to keep a really close eye. And we had just sort of reached a point where, we were getting all these ultrasounds, biopsies. These are, invasive, not super invasive, but they are invasive office procedure type things. And so we just had a conversation of, maybe we consider a hysterectomy. And then also with the ovaries, talk about removing ovaries as well, because we were already taking medicines to block the hormones. And it was good that we did the hysterectomy we did, because she did have some precancerous changes inside the uterus. So I think we were inevitably going to end up at that place.
And you had said, though, this is not a common thing. Most women, it doesn't turn into cancer.
Correct.
But Angela got the luck of the draw, just the cards you were dealt. And you handled it so well.
Thank you.
I have to ask you, that's a lot for your body to take. You've got a cancer diagnosis, then you're diagnosed with precancerous cells in your uterus, you have a hysterectomy. Did you keep working out through all of that?
I did. I did.
Well, define working out, because a lot of people don't like to exercise when they have a cold, right?
Yes, right. Yes. I would work out before, when I was competing in my fitness competition. I would work out like 6 days a week, and then when
that was through your chemo, though. You're working out 6 days a week too.
No, through my chemo, I was working out 2 to 3 days a week, and then once I got through all my chemo, then that is when I decided, I might as well compete in a fitness competition.
Okay, because why not?
So why not? But honestly, it's a combination of things. It's fitness. It was having the best doctors around, truly, and all of my doctors working together as a team. Because without both of them and Dr. Porter and all my other doctors that were involved, without them and the fitness, and my faith and family, I would not be here today.
I can tell you, she was always just like this, all the way through her.
Just like a bubbly, like a butterfly. She is a butterfly.
What can I do?
Yes.
And that makes a big difference.
Yes. Yeah.
Well,
absolutely.
Pretty special to see, if you could see behind the scenes when Angela came in, and I told her Dr. Fabian and Dr. Jewell were going to be on the set with her. She said, "Oh my gosh, right next to me." I said, "Yes, you're going to be right between them." And she lit up. It was like this effervescence. It's really, really special to see. I want to ask Dr. Fabian about cancer prevention, because you founded the Breast Cancer Prevention Center at the University of Kansas Cancer Center. What is the biggest thing you start off with by telling people who are facing a cancer diagnosis?
Well, Breast Cancer Prevention Center really is for people who are at high risk for cancer, not that already have cancer. But whether it's really for to prevent breast cancer from developing, or in conjunction with your definitive breast cancer treatment, or even in the survivorship period like she's in now, that healthy behaviors is always where we start. You know, eat healthy, don't gain weight, exercise.
And that's exactly what Angela is doing. Does that change for people who come to you and they say, it runs in my family? My mom had it, my grandma had it, my dad might have it, I have the BRCA gene. Like, what advice do you give them for cancer prevention? They don't have it yet.
Well, in addition to the things that we always read about in the newspapers, getting supplementary screening instead of just a mammogram plus a breast MRI, consideration of prevention drugs. You know, a drug very much like she was taking, tamoxifen.
Right, yes, absolutely.
Whether you're a BRCA1 or 2 mutation carrier, or ATM carrier like she is, or just at increased risk for breast cancer, the studies really show that exercise, especially if you ramp it up to 200 minutes a week, and healthy behaviors can reduce your risk by a relative factor of up to 1/3. That's huge.
That's major.
Absolutely.
And it does so many other good things for you.
Can you yet prescribe exercise to a patient? Can you write it out on a prescription? Dr. Jewell, can you do that?
I don't. It just depends on, I guess, if they're going to go pick it up and you know, follow through. We certainly talk a lot about it, and just a healthy lifestyle, and a lot of, you know, we're getting a lot better about curing a lot of cancers, and so what we're now seeing is that patients in survivorship are actually dying from things like heart attacks or secondary to other conditions that they have, and so that emphasis when she was talking about survivorship, it's so important to say, okay, great, we got you through this. Now,
what do you do?
Let's focus on keeping you around for as long as possible.
If you could write it as a prescription and insurance companies would cover a gym membership, would you do it?
Absolutely.
Oh, yeah.
Would that be like your #1 thing to prescribe?
Yes.
Yes.
That's powerful.
We actually found in a research study where we covered the gym membership, and we covered 2 days a week personal trainer. That women who were totally sedentary, that have breast cancer and were totally unfit, that they could be schooled, if you will, to improve their fitness, and that they would even keep it up after we didn't do the personal trainer. And I just wish that more insurance carriers would cover a gym membership. That's so important.
It would keep you. Everyone likes to be busy at work. I imagine you hate being busy at work, right? That's kind of a nightmare when you see that. And we've been talking about how life after cancer comes with its own challenges. So I want to bring in cardio-oncologist Dr. Porter again, Dr. Charlie Porter, with what he had to share about that.
You know, with breast cancer, you know, 88, 93%, 5-year survival. You know, breast cancer. Women with breast cancer, especially early stage breast cancer, need to be thinking past their breast cancer treatment. They've got a life to live out there, and at 8 years out, their risk for cardiovascular disease start to exceed the risk for recurrent breast cancer.
Dr. Porter, for cardio-oncology, he specializes in any problems with the heart that developed from the cancer treatment. Unfortunately, things that save your life, it's like a cruel twist. The things that will save your life also can cause their own problems. Yes. So Dr. Jewell, do you suggest all of the patients you see also see a cardio-oncologist? How does that work?
Well, I mean, if they had the availability, that would be wonderful. But you know, I certainly encourage all my patients. They need to have a primary care physician. They need to have someone that's monitoring all their other health conditions, all the other screening. But yeah, a lot of the medicines that we prescribe to patients can cause problems like hypertension, can cause impacts on the heart, and so we do refer many patients. He is invaluable to us and our patients in helping us co-manage and really help help us out with extra screening, extra prescription medicines that patients might need, things like that. So,
well, Dr. Porter feels the same way about both you doctors. He's the reason Angela is here. He said, I've got 3 amazing women, 2 are doctors, one's a survivor, and you have to have them on All Things Heart. So I want to ask, Angela, what was Dr. Porter's biggest advice to you when you came and saw him?
Continue to work out. It's going to help your heart, and it's going to keep your heart strong. And I told him about the foundation that I'm going to start or starting, and his reassurance and what he was telling me about the research and everything. I was like, this is what I'm going to do. This is absolutely what I'm going to do. We're
going to get to your foundation in just a minute, because it's pretty special what this journey has brought you to. To go along with that research shows approximately 80% of adults in America and kids ages 10 to 19 are not active enough. Here's what Dr. Porter said about that.
Studies show, there was a retired men walking in Hawaii that showed that walking 2 miles a day on the average, which relates to 30 minutes, that's a couple, 3 hours a week, they had half the death risk as people who were walking less than 1 mile a day in the same environment. So that's just walking. And this same study that showed men had less cardiovascular disease mortality also showed that there was less death from colon cancer in that same population.
It's incredible. The research shows regular physical activity lowers your risk of dying from cardiovascular disease, lowers your risk of developing hypertension, it gives you brain health benefits, reduces anxiety, lowers your risk of depression, among a slew of other things. And as our doctors have been telling us, adults should do at least 2.5 to 5 hours a week of moderate intensity exercise. But as doctors have also said, gosh, if you can just walk every day, that'll be huge. Muscle strengthening activities, 2 or more days a week, can be tremendously helpful. Not to beat you over the head with it, but it sounds like the wonder drug is exercise. If you could bottle it and prescribe it, these doctors, and Angela is saying she sure would. We have lots of questions from our viewers, and again, we want to get to your foundation in a minute. Let's start with our community questions. Jenna has a question for Angela. She says, were there ever days you thought to yourself, there is no way I can get up and work out?
There were not.
There were no days that you had that?
There were no days. I was weaker than some. Some days after I would have chemo treatments, I would never obviously work out on Thursdays, which those were the days. And then Sundays were my difficult days. So there were always 2 days that I did not work out. And I get left 1 day for my body to recover. But it helped my brain so much. It helped me feel strong, but it also helped my brain be clear and stay focused on everything I needed to do. There was a lot going on at that time. I had 2 little bitty kids, and I was teaching school. There was just a lot going on, and I had to be strong for my kids and to get through this journey of breast cancer.
I think we might have buried that part. You had 2 small children throughout all of this as well.
Yes.
Holy smokes.
Yes.
That's a lot.
Difficult.
That's a lot.
Yeah.
Teresa has a question for Dr. Jewell. Teresa wants to know, how common is it to develop precancerous cells on your uterus from breast cancer treatment?
So like I said before, it is not that common. So because I really do want to reassure patients that the overwhelming majority of patients taking tamoxifen do not develop precancerous or cancerous cells in the uterus. But we know that the medicine can put you at a slightly increased risk. So it's very important, if you're having symptoms, that you are plugged in with a GYN oncologist or a primary gynecologist who's comfortable doing surveillance, doing biopsies, and making sure that nothing is being missed. But the majority of patients do not develop precancerous changes or cancer. So I do really want to reassure patients, like, take these medicines. Their health benefits and protective benefits are very proven. You just need to make sure that you have good surveillance.
Which
absolutely, yes. And Dr. Jewell, she was always monitoring on it very closely. Yes.
Dr. Fabian, Jody wants to know, how do you weigh the risks, the potential risks, which are slim, and the benefits of using drugs to fight breast cancer?
In Angela's case, she had a strong family history of heart disease. So that was our first consideration. And one of the medicines to fight her type of cancer, Herceptin, over a long period of time can cause heart problems. Hence the importance of the cardio-oncology and the monitoring that way. But we also know that some of the other chemotherapy, adriamycin, really can cause some heart damage. So we selected different drugs for her. And that's so important to weigh the risks and benefits of each individual patient with their personal history and their family history to decide. I just want to follow up on something that Dr. Jewell said. Less than 3% of women are ever going to develop endometrial cancer from tamoxifen, which is the drug that Angela took for 10 years. It's a pill. It's an anti-hormone pill. We're looking for better ways to put that to zero. And for prevention, we now use, at least in postmenopausal women, low-dose tamoxifen that doesn't increase the risk of endometrial cancer.
It's a balance. It's a constant balance. I want to get to your nonprofit in a second. I have one more question. Sure. This is from Ruth. Ruth wants to know about nutrition and what role nutrition plays in survivorship and the exercise journey. I'll talk about survivorship with Dr. Fabian first. Nutrition. Nutrition, we know exercise is important. What do you tell your patients about nutrition?
Eat a balanced diet. Try to 5 servings of fruits and vegetables a day. Try to avoid processed meats and other heavily processed foods, and try to keep that alcohol intake to less than 7 drinks a week. Probably most importantly, and I know she does this, is get an adequate amount of vitamin D as well.
Okay. Yes. Angela, how do you get your vitamin D?
I take a supplement, and I try to eat foods, obviously, that are enriched in vitamin D. But the vitamins are extremely important, you know, to help everything kind of come together, you know, and work together. So.
Tell us about your nonprofit, because you've made this your life's work to help other women who have just been diagnosed with cancer, and there are women watching who might have just been diagnosed.
Yes. So as both of the doctors were saying, and Dr. Fabian was saying that, you know, it would be wonderful if insurance companies, you know, would cover the cost of, you know, gym memberships and personal trainers, and that is exactly what our foundation does. So we, my goal is for patients that see Dr. Fabian or, you know, any other, you know, doctors here at KU that have breast cancer, that they have the opportunity, they give them the opportunity to call my foundation, and I want to be able to work with those you know, that are going through this journey, and I want to be able to do personal training for them. They're open to our gym. There's no charge for personal trainer. There is no charge for the gym, and I want to help get them on the right track so that they can feel confident again. Right. Because it's about working out, but it's also about building their confidence. When you are going through breast cancer, you lose your hair, you lose your eyelashes, you know, everything. And I'm a total girly girl, you know, and so it's very scary. And I feel that a lot of women might not have the strength to, you know, to fight it, and the mindset. And so the goal of the foundation is working out, and for me to be able to provide them, you know, ways to show them how to work out correctly, to have, you know, a list of like physical therapists and, you know, cardiologists, you know, and whatnot, and the gynecologist to go to, you know, when they need it. But it's being able to build their confidence so that they will feel beautiful again.
And live and survive and keep living like you.
And no, it's not. You know, this is not the end, you know, of my journey. You know, this is just beginning.
Well, clearly, I mean, well, how does it feel to, well, actually, hold that thought, because we're bringing everyone back in for some final thoughts now. Angela, I first want to have you listen to something else that Dr. Charlie Porter said about you.
I'll just tell you that as a cardiologist, I think I might have mentioned this to you before. It's good for a cardiologist to think the patient has a big heart, but that's different from telling them they have an enlarged heart. One's good, one's not so good.
He went on and on of what a big heart you have.
Aww.
And I could see you tearing up when you look and see your doctors on either side of you and Dr. Porter. What do you want people to know?
That it is possible. That it is possible when you are diagnosed with something this severe and the stage that it was in. You put your trust in your doctors. You listen to what your doctors are telling you. You stay focused. You know, don't. The alcohol is no. You know, that is just not okay. The balanced diet, having the support around you. Your doctor's support, believing in yourself, you know, working out, and just to come back, to know I can come back from this difficult time in my life, and I can be stronger, and this is I'm going to be better than I ever was before, because I truly do feel now that I am stronger, and I know I can overcome anything. I know I can.
You're going to help so many women, and you are right now.
That is the goal, and I know that this whole journey was put into my path for a reason. I firmly believe that. My doctors, they were put into my path for a reason, and I want to be able to give as much as I can back to other patients that are going through this.
Dr. Fabian, how does that feel?
Oh, incredible.
Yeah.
And again, I think what she is wanting to do and is going to do, I have no doubt, is one of the most important things for breast cancer prevention, breast cancer treatment, and breast cancer survivorship. And both Dr. Jewel and I really applaud you.
Oh, well, thank you. Thank you. And if it wasn't for the two of you and others, I would not be here. So,
Dr. Jewel, this must be so cool to see a patient come back full circle and be thriving.
Yes, it is. And I really want to echo this multidisciplinary approach. And and I just encourage all patients to really advocate for that for themselves as well. Like Dr. Fabian and I have many patients that we share together. I ask her questions all the time. We refer patients, and it's really important that I think all cancer patients are in a situation where you have access to that, where you have multiple specialists that are weighing in and treating you.
It's like you have all of the Kansas City Chiefs behind you if you were an athlete.
Yes.
Like you have a team of these superstars that are helping you.
Yes.
We love sharing the incredible work that our doctors do.
Yeah.
We love it. We also love sharing what you guys are like, you gals are like, outside these walls.
Now for a secret look into the guardians of healthcare at the University of Kansas Health System. Let's go behind the mask.
We are taking you behind the mask, starting with Dr. Fabian. You are a grandma. Tell us about all your grandchildren. You're so proud of them.
I am a great grandma.
A great grandma?
Yes, I am. I have 4 grandchildren ranging in age from 19 to 6, and they all live here. And 1 great-grandchild, and he is 6 weeks old.
Oh, adorable. And we have a picture of that's
There's
one of your
the youngest
grandbabies. And
grandchild, and the great-grand
let's see the great-grand. Hold on.
Is in This is Liam watching the Chiefs game last Sunday.
Oh my gosh. I gotta say, times have changed because my grandma was just making me delicious food and feeding me. You're like helping solve cancer. You're curing cancer. The times are different.
Make delicious food.
I'm sure, but wow, you do it all. Okay, speaking of football, we had your little football-sized great-grandbaby. Now we want to go to Dr. Jewel. Well, speaking of football, who are you here with? Looks like Coach Reed.
Yes, that was another Cancer Center event, and that's one of my other patients that we went to an awesome Crucial Catch event and got to meet some of the players and see practice, and we're actually going to be at the game next Thursday, so look for us at halftime.
Beautiful, and you're also very active. You're an adventurer. Is that you on a motorcycle? motorcycle?
Well, that's my husband.
Okay.
So my husband builds and rides motorcycles, and this was us in Hawaii, and we got on a bike and did the road to Hana.
Cool.
So.
And you've also done some pretty, is that you, okay, are you scaling a waterfall?
That is. It's rappelling down a waterfall, and I'm deathly afraid of heights, and so I have made a thing for myself that every time we go on vacation, we do some height activity that I'm terrified of, that I like make myself do it to like conquer that fear and show that
desensitization, right?
Yeah.
Isn't that like it's kind of therapy people do for their phobias?
Yeah, I added this one specifically for Angela because I thought she'd be proud of me. This was, I was 6 months pregnant with my first kid, and we went hiking in Patagonia, and this is me down by the icebergs, and we did 21 miles in 3 days, and so
that's amazing.
She would be.
That is absolutely.
You can impress Angela.
I couldn't do that. That's amazing.
That's incredible. Thank you so much for sharing those pictures, Dr. Jewel, Dr. Fabian, Angela. I cannot wait for when your nonprofit officially launches, and we can give our viewers more information on that.
Absolutely, yes.
This has been very special.